Welcome back to part two of our two-part episode with Dr. Alan Greenglass. Dr. Greenglass is an internal medicine physician, a co-founder at the Mid-Atlantic Alliance for Climate and Health, and the author of Curing Physician Management, Why Physician Managers Fail. We had a wonderful conversation in part one about his journey to medicine, his experiences with medicine before Medicare and Medicaid, his experiences within multiple medical systems with the healthcare disparities and how to bring equity into healthcare, and now as an advocate at the policy level for health equity and climate justice. Alan, I want to give you a little time here to tell us a little bit about the book that you have written, Curing Physician Management, Why Physician Managers Fail. Tell us a little bit about your book.
Yeah, it's. I think there's a link to what we were talking about in part one about how I got here. But I got into management and leadership for all the wrong reasons. Not the wrong reason of why I thought it was important and why I wanted to try to make a difference. Not just in the individual patient care that I was doing, but also in terms of being able to influence how healthcare is designed and planned and made available for people. And so, I thought that management was a way of going, and I was inspired. I'm not quite as old, I'm not totally so old, but I said I was in training. I was in medical school, really started medical school about the time that Medicare and Medicaid started, right? And so at that time, I was started learning a lot about healthcare, how healthcare can be delivered in systems, such as Kaiser Permanentes and Harvard Community Health Plan and Rhode Island Group Health. I'm mentioning places that I either worked for or was able to learn a lot from, or group health in New York City. And so I was interested in management, and I was in this startup health maintenance organization. And what people may not realize that the HMO Act of 1972 was actually signed by Richard Nixon, and Richard Nixon also was the president who signed into law the Environmental Protection Agency. So, times have changed about how different political philosophies have been applied to public well-being. And so I decided that I want to be in management. And the person who I reported to as in an internal medicine department of this small HMO resigned, and nobody else wanted the job. And I was in practice for 1 year, had no management training, no training in how to work with people in terms of how to recruit, how to interview, how to run a meeting. But I raised my hand, and because nobody else wanted the job, I was appointed. And in the course of about a year and a half, I didn't do a good job. And my boss came to me and said, Alan, it looks like you're at the front of the bus, but you're not steering it. And we're going to replace you. And that was I knew he was right intellectually, but it was my ego was hurt because I thought management was intuitive. I was smart. I was a good doctor. My patients liked me. My colleagues liked me. And so management couldn't be that hard. But he said, I'm going to give you a chance to learn what it means to be a manager and a leader. We're going to have a training program for leadership, our physician leadership, and I want you to be part of it. And through that, I was given a mentor, and the mentor came to me with an article that had not been published yet, which was written by two folks from the business school at the University of Southern California. It was called Why Physician Managers Fail. And I went through the points of that article and we discussed it. And there were like 8 different points. And I kind of failed on at least 5 or 6 of them. They were not having the skill set, not having humility, not being able to put your ego on the shelf, trying to surround myself with people who I liked and liked me, uh, wanting to be liked. Now, that applies to management in many different settings, but it certainly applies a great deal in healthcare because very often we choose a physician to be a manager or a nurse practitioner or a physician assistant to be a manager and a leader. And they're not quite the same, management and leadership, but they overlap. And because they're well liked and they're a good doctor, not because they have skills that will lead them to be successful as a manager. And very often, I came across folks in the course of my career who were chosen just for that reason. They failed. Unlike me, they weren't given a chance to develop the skills and work through their acceptance of that failure and to move on from their maybe negative feelings about it. Every human being likes to blame somebody else for their shortcomings. Physicians are no different, maybe more so because we spend a lot of time saying you're infallible, you're on a pedestal. We may not like health care, the health system, but we like you as my physician, as a physician. And so very often we saw people who gave up their practices to take on management role, failed, and then were kind of had to leave the community because they felt they couldn't stay because they were now failures. And so I decided to write this book to jump off from that article, Why Physician Managers Fail, and to write and to write not a prescription, but a number of talk about the skills, why we might fail, how to prevent that, and what the skills are that we need to develop to to have a greater chance of being successful. And I will tell you that sometimes we make decisions in healthcare as clinicians taking care of patients, and also as managers, and we did it wrong, but things turn out right. And sometimes we do everything right, and things turn out wrong, right? I mean, we treat that patient by the book, but they don't get better, or we do all the right steps in terms of management, in terms of getting input and getting all sides of the story and getting data, and we make a decision with our colleagues, and turns out we made the wrong decision. And so it's not it can't always say it's going to work out if we do everything right, or not work out if we do a lot of things wrong in our decision-making process. But I'm looking to optimize that. And I include a lot of stories, all true, all involving me, in which some things were unbelievable, how stupid we behaved, or somebody behaved, because, as I say in the book, Mr. Spock from Star Trek doesn't show up for work every day. Sometimes the person you're dealing with is Dr. McCoy, and it's not a rational person who you're trying to help do a better job. It's not somebody who can accept that there's some way that they can improve.
Well, I want to say, Alan, first of all, that in itself is a leadership lesson, right? You wrote this book with all of these stories about what you call are failures, but that is leadership, right? Where the leader leads with their vulnerability, not other people's vulnerability, not holding up other people's failures, but holding up their own, I won't even call it a failure, their own lessons for others to learn about. And And I don't think physician managers fail. I think management fails very regularly. The system is set up for managers to fail because generally a high functioning employee, for whatever reason, is promoted to manager, which requires completely different skills than being a high functioning employee. And as a manager, they have to manage, which is different than leading, but they are now supervising a group of people, which requires leadership skills. And I have been in all of these places, many places over my career, and lots of leadership positions. There is no leadership training program before you get there. It's always who volunteers and who looks like they might have the characteristics to possibly be in the job. And you are lucky that whoever the leader was above you realized that training and mentorship was an important part of being a manager. But most people go through their career, and unless they do that themselves, they never receive training or mentorship. And so many people work in healthcare institutions surrounded by struggling managers. Yeah, I have a lot of sympathy for them. I don't think they mean to be low functioning, because these are people that are A+ overachievers to start with, but they don't have the tools that they need to thrive in that environment.
Yeah, and at one point I tried to make in the book, and this is a point that came from the original article that I was given, is that some of the things that some of the personality traits and some of the ways we're treated and during our training creates behavior patterns or other personality traits that may be not consistent with being a good manager. For one example, I talk a lot about teamwork in the book. Well, teams mean different things to different people, and very often to a highly trained type A person, a team means people who are going to follow me, right? The quarterback of the team. And and I cite a book in my book about that called Team Play. And whereas the team that you need very often in any type of, I'm just going to talk about healthcare situation, is a team where there's more of a give and take. Everybody's dependent upon everybody else. The example I use is, if you're a basketball fan, the Boston Celtics or the New York Knicks of the 1970s, where everybody fed off everybody else, and there were facilitators. The stars needed somebody else to pass them the ball at the right time in the right place so that they could take the right shot. And very often we were trained to be, just let me, follow me rather than help me be successful. And my definition of leadership is somebody who helps other people be successful. And it's not just my definition, but it's the definition which I've chosen to live by.
Alan, what do you want people to learn or to do after reading your book?
Well, I want them to have a little bit of humility. And it's really hard for any of us to have humility, but to know what you don't know. Unless you have some degree of humility and are willing to learn and know that there are things that you don't know, and you may not even know it, that you don't know it. That sounds weird. That it's hard to improve. It's hard to build a team. It's hard to give up responsibility. That humility is not a weakness. It's actually a strength. And there's lots of research that's been done about that. And that, everything I'm talking about, I didn't do the research, but there's lots of research about the roles of humility, about how different teams function, how different personalities need to be able to integrate and mesh together, the importance of having skills and not just personality. I think those are the important messages.
Yeah, I think you're channeling Brene Brown a little bit there. Humility is strength. And actually, once you get over the fear, humility brings about a lot of fear. You can realize the strength that comes from that. She calls that an open heart, strong spine. But that is the heart of leadership. I like to do a little bit of kind of projecting your best version of the world forward. If you could ask for anything to help you, us, make progress on health equity, who would you ask and what would you ask for?
I would probably ask my neighbors and say, get involved. But that's kind of a broad statement. But I want to go back to this organization that I co-founded called Mid-Atlantic Alliance for Climate Health. What we realized was there are all these organizations, including health-related, the AMA, the American College of Physicians, the AAP, ACOG, which are concerned about climate change and about environmental degradation. But they were all working in silos, and they were not talking to the environmental groups, the Sierra Club, the League of Conservation Voters, the Nature Society, the Nature Conservancy. And so my real practical ask in terms of policy, in terms of moving society forward, would be equity, environmental justice, climate justice is in the lane of healthcare professionals. You can't do it alone. Partner with other clinicians, clinical organizations. The ANA also has a climate change policy, and partner with the environmental groups and people in your community to work together, because working together is much more powerful. Bringing the health voice to people who know how to write legislation and how to talk to the governor and your state representatives in a collegial way is exceptionally powerful. And that's what I would say. Take your individual powers and bring them together, and it's it's multiplicative, not just additive.
And that'll bring us to why this podcast exists in the first place. We are trying to bring those voices all in one place where they can speak to each other, hear each other, and find each other to collaborate. And we really appreciate you joining the conversation today. How can our audience connect with you and with your organization?
You certainly can email me, and maybe if you can capture this and link it, but agreenglass42@gmail.com. And I'm happy to share information. People want to know about heat islands, or want to know about indoor air quality, or want to know about asthma and environmental risks because of that. Once again, I'm not the smartest person in the world, but I've been able to learn from a lot of other very smart people. And the same goes for my management background. I was able to learn from people and be exposed to lots of different ways of doing things. So I think let me know. And we deal in Delaware and Southern Jersey and Southeast Pennsylvania. Talk to people in Maryland about kind of replicating on a regional scale what we can do on a Delaware. We can do things that you can't necessarily do in a big state, but you could break it down on a county level and form partnerships between healthcare folks and environmental folks and state policymakers, and it works. And we've made a lot of progress here.
That is awesome. We will put the email in our show notes as well. Please reach out to Alan Greenglass. Find out more about his book on management, if that is your area of interest, or contact him about climate, health, and justice through his organization, MAACH. Thank you for joining us today. In our podcast, we frequently highlight and explore the vital role of collaboration with public and private enterprise, government support, sustainable health innovation. If you're a public health officer or a dedicated public official working to enhance healthcare access and equity, we would love your voice on our show. Please share your valuable insights and perspectives with our audience. You can contact me at Dr. T, Dr. at haew.org to secure your spot on the podcast. Listeners, please, we need your support as well. Please share today's episode with a friend. Please leave us a review. Share your thoughts. Start a conversation. And if you're interested in being a guest, please email us.